Hello, everybody. Good evening. My name is Kauna Malgui. I'm the founder of Digital Rights and Mental Health Initiative, and I'm happy today to host you all in today's webinar. So, today's webinar, we're going to be discussing a very interesting topic. It's been, um, would I say, a generally recognized a month of men's mental health. Duration where we just talk about everything men and mental health and even every other issues. And of course, I'm so happy to host you all. And today we have uh, a very important guest in our midst. We have uh, my co-host, who is my co-host Joshua Adeni, who will be helping co-hosting this wonderful event today. And we also have our speaker, which will be going into that a bit shortly. But let me allow Joshua to just say a word as I continue as we continue with the meeting. Thank you.
Okay, thank you very much, Kauna. It's a privilege to be here to listen from the great minds and the experts on, what is considered as a pandemic at this point about what masculinity is and how it shows up and how it shouldn't show up in today's society. Given that this month has been all about mental health, and specifically today we are discussing the man's mental health because the man is the person that carries the burden of the society. So I'm glad that we're able to, have this conversation today. And I'm hoping that everybody in this seminar is able to learn, a couple of things from the speaker today. So I would encourage us to be open-minded. Um, if we have any questions, we should ask. There are no wrong questions. Your curiosity is very, very welcome. Would also encourage you to, take notes and jot things down, as I believe this is going to be a very splendid session, right? So I would like to hand over the class. I think I can hand over the class to Dr. Ibrahim at this point to take us on what I believe will be a wonderful session. So over to you, Dr. Ibrahim.
All right. Thank you very much, Joshua, and good evening, everyone. As we are all aware, June has been tagged as the month for the mental health of men, and all over the world, this is being celebrated. And today we will be discussing redefining masculinity, men's mental health in a changing world. So, and we are going to learn about mental health, the global perspective. What are the factors that limit men from accessing mental health services? And also, what are the key features that we see in men that are having mental health issues, which may not necessarily be obvious to everyone. And also we'll look at how we hope to change this narrative towards having possible solution. So why does men's mental health are very important? This is very important because it has been shown that millions of men all over the world are suffering from various types of mental health issues, ranging from depression, anxiety, post-traumatic stress disorder, and other form of expectations that have led men into distress. And this unresolved distress in men directly impacts either their family, their neighborhood, their place of works, their marriage, that's their spouses, and generally the community in which they function. And you agree with me that over the years, the suicide rate among men has been recognized, although deliberate self-harm and attempted suicide is higher in women. The rate at which completed suicide are committed is actually more among men. And globally, about 700 to 800,000 people die annually by suicide. And a significant number of these are actually men, which we don't usually look at. And in Nigeria and Africa at large, one of the major concerns is our culture. They say men don't cry. In fact, if a young boy comes and he starts crying, you will see how parents will spank him or they will beat him. They say, "Man up, are you not a man?" But when the girl cries, they condone that. But as a man, you are not even entitled to express yourself. And this historical and cultural culture has left a lot of people dying in silence and carrying a lot of heavy loads, either economical, spiritual, and other forms of pressures. And it is very difficult for these men to express themselves. Also, if you look at it globally, the rate at which men commit suicide is about 10.1 when compared to general population, which is around 18. And also there is shortage of services that can be patronized. In Nigeria, about 80% of persons with mental illness do not actually have access to services, and there is high risk of substance use disorder among the male gender. Now, also, as I mentioned, there is shortage of manpower when it comes to services for people that suffer mental illness. And that means with this shortage of service, the tendency is so many people will be dying in silence because they do not have this tendency to access the service for whatever reason. And for example, Mr. A is a 45-year-old person that lives in Lagos, actually a CEO who has been experiencing profound poor sleep, which is called insomnia, chest pain, and extreme irritability. This person refuses to visit the psychiatrist, claiming that he's a leader, and as a leader, he cannot show any cracks or sign of weakness. So he only presented in the hospital when he thought he had a heart attack, and they now realize it is a panic attack, which is a form of diagnosable mental illness. Also, another case is that of an unemployed 27-year-old who has been unemployed for 4 years. He reported feelings of complete failure to his family members, and to cope with shame, he withdrew from interacting with people and turned to heavy use of codeine and alcohol, which he used to mask the major depressive disorder that he is experiencing as a result of unemployment. And to tell you the truth, the current world generally has affected men, especially the economic volatility, where people that are employed today, tomorrow you can go to work and realize you have been sacked. The general uh, economic meltdown has actually affected men. And there's also shifts in the gender dynamics. Sorry, I'm not being an advocate of inequality. We support equality, but you understand that of recent, more and more women are empowered. So this tends to affect the male gender, because especially in the Africa, men are used to taking charge and other things. So gradually losing that male dominance can also affect certain people as women begin to engage, get financial and also academic independence. So this may also affect some men, especially those with inferiority complex, and it can affect the family structure and also other forms of relationship. So it's also important for us to understand what is this masculinity. So masculinity is not actually a static biological absolute, but it is dynamic. It changes and over the time. So it's sets of these are sets of socialized behaviors that men display or expectations that the society have on these men and the role that they have learned over the years and they perform. And this constantly can be renegotiated over the time. And sometimes the loss of this role may tend to affect the identity of this person, leading to several mental health concerns. Traditionally, you agree with me that traditional model foster positive traits like
I'm sorry, can we hear Dr. Ibrahim again? It's just me.
hello, can you hear me?
Yes, we can hear you now.
Okay, sorry. So also it is important to note that these values provide vital stability when properly channeled. But in the event where there are challenges, this will now affect the masculinity of the individuals. And also the dark side of these rapid changes that occur is actually the emotional restriction that men often feel, and they feel there is extreme sense of reliance and helping for help when they are weak, and all.
Dr. Ibrahim, your mic is mute if you're speaking.
Okay,
Okay.
sorry, it keeps. Sorry. So I was talking about the key mental health challenges among men. Among men, it does not really present like the key or men depression you see, like sustained undue feeling of sadness or the okay, can we continue? All right, so I was talking about the mental health challenges that men face, and I did mention that men usually express the atypical form of depression. So the sustained undue feeling of sadness that we typically see may be masked, and you see somebody that is up and about, somebody that is even laughing excessively and moving, which is daily routine. And instead of sadness, sometimes you experience anger, and also you can see an increase of people that have excessive substance use, either increase in the previous substance they are taking or introducing substance. And usually they take these substances to self medicate. So they could take alcohol, benzodiazepine, and codeine. And also there could be excessive form of anxiety which they may be dissipating through work. So you see them working excessively when they are supposed to close from work. They don't close from work because they are actually trying to mask this depression. And also, due to occupational reason, there are a lot of men in military uniform servicemen, so they are exposed to several forms of trauma. And some of the construction work and also high risk work is usually occupied by men. And so they experience a lot of trauma also while they perform this function. And we are also aware of economic crisis and other form of challenges that men do also experience that can lead to trauma and post-traumatic stress disorder. So, how do you identify distress in men? Usually, when men are distressed, they usually do not speak out. You see them becoming excessively irritable. You see them becoming angry, and this can promote or can be seen in domestic violence and also cases of gender-based violence and road rage and other forms of explosive anger. And they may also, in an attempt to escape from the stress which they experience, they may begin to channel their energy towards work. You see them doing a lot of work, or they may do some risky behaviors like gambling, unhealthy behaviors like spending a lot of time on their screen and other phone. And they may also have some unexplained symptoms. In fact, we have had cases of penile disappearance. I'm sure you see that around Abuja, Jos, where men can just come and tell you their male organ has disappeared. And it has been termed as a form of heightened anxiety among men who have been distressed and begin to dissipate their energy and present with such symptoms. And they may have unexplained headache, unexplained body pain, and also changes in body functions. So these are all distress that can be seen in men, which are not usually typical, and they may not even go to the hospital. So it is important as psychosocial promoters to begin to identify these so that solution can be provided to such persons. However, the real challenge is men do not like seeking for help. One of the reasons they do not like that is because there is stigma, fear of discrimination, fear of judgment. Why will a man like you go and complain that you are passing through trauma? And also, men usually try to show that they are men. Because of that, they try to handle their problem and show no sign of weakness. But the inability to access these mental health services and also the cost of these services, like rehabilitation, drug rehabilitation costs at least about $1 million. 3 month service is about $1 million. And you agree with me that so many men will not be able to access this service. And how many psychiatrists do we have? So far, there is a psychiatrist to about 250 uh, health and people seeking for help. So, which is against 1 to 10 that is recognized by the WHO. So you can see that there are actually no services available. So, but in an attempt to redefine this, we want to say that it is 100% courageous to make yourself vulnerable, to identify yourself as someone who needs service, someone who wants to be who wants to access service. It is not a sign of weakness. So true strength is not suppressing the pain. It is actually having the courage to assess or to speak up or to discuss with someone that I need help. I'm really passing through a lot. This can be a friend, this can be a colleague, and this can be somebody in the community or such platform where people can access. So it is important to understand that it is part of masculinity to identify that you are human and you could be passing through one form or the other of psychological distress. And in order to build emotional resilience, it is important for people to identify complex emotions. So it can be anger, frustration, easy irritability, and it is also important to secure vulnerable connection, build genuine peer support cycle, identify individuals that can be of help. In some communities, like in the Northeast, specifically Meduguri, there are actually safe spaces for men where men can go and mingle, interact with fellow men who are passing through psychological distress. They will be able to open up to their peers and tell them what they are passing through. And there are usually psychosocial support counselors, psychologists, and psychiatrists who come around to provide basic services. And it is important also for men to identify positive coping mechanism, to know that when I'm sad or I'm not able to sleep, it is not okay to take cigarette or other cannabis, alcohol, codeine, and other form of substances. Rather, it is important for you to assess or substitute this with access to services where you can get services and you'll be able to practice mindfulness, and also to stay away from drugs and engage in exercises. It can be as simple as a walk or jogging or going to play games like basketball and badminton. And one behavior or habit that we have is we often go and do full blood count, check your liver, you check your kidney, but nobody goes to check his mental state. It is important for us to know that checking for mental state is as important as checking for those other systems, because no matter how good your other systems are, when your mental state is not intact, you are also not well. Definition of health by WHO says that you must be fit, both physically, socially, as well as mentally. Anyone that is defective shows that one is not healthy. And one most important thing is to identify our recovery capitals by leveraging on existing network. We should know that from the cultural perspective, we usually used to stay in community with good neighborhood and family members. So it's important for us to allow men and boys to socialize among themselves and express whatever emotion they are going through. And other forms of services are actually faith-based services where we can pay a visit to either the church or some of the fellowships with men's fellowship, youth fellowship, the mosques we attend, and also other forms of spiritual activities. These are enriching spiritually and help people to vent their emotion. And also for us to keep understanding that some of the things we do, like discussing about football and some healthy political discussions, are actually good for our mental health. So in the north, especially in Meduguri, there's this thing we call Majalisa, where men gather in the evening to recap the day, to discuss after closing from work before they retire home. And there's also other healthy forms like bringing food outside, where the people from the neighborhood come to eat. While they are eating, they talk and laugh. So, and I'm sure there are town centers in the east and western part of the country which have been seen as form of network that we can leverage upon to build our mental health. Then it is important for us to know that the workplace is very important. We often realize that employers are only interested in the tasks we execute. And sometimes the stress and the mental problem is actually coming from the place of work. So it is important for CEOs, supervisors, and other superiors to understand that healthy interaction between a supervisor and the supervisee is very important. Giving achievable goals is also important, because when individuals are overwhelmed with the targets, you realize that their mental state will be affected. There is important to create some time for interaction where you allow people to seek help and vent about their mental state. And also, it's a full implementation of the Mental Health Act will make mental health services accessible, especially in the primary healthcare centers, which is often very close to most individuals. And that will further make services accessible and affordable to men in the community and also in their places of work. So, by way of collective call to action, I would like to say that for individual men, we need to break the silence. We need to reach out to a doctor or psychologist or psychiatrist or a trusted friend whenever we are having challenges. You are human. You are a man does not mean that you cannot feel emotion. Is that okay? Your body is not a wood. You are not a wood. You have emotion. And when they are distressed, you should speak out. Also, for family and friends, it's important for us to identify changes in our brothers, in our friends, in our spouses who may be becoming irritable, unduly explosive, or keeping a lot of time in the place of work, or increasing the quantity of substance they take. So as simple as saying, how are you doing? How are you really doing? Are you okay? So you can even offer to say that you are available to speak to the person whenever the person feels like talking. And at the level of the society, it is important for us to discard those archaic way of thinking that punishes men or boys when they try to express emotion or when they try to place themselves in the position of vulnerability. So we need to build a culture where we make it open for people to dialogue and to talk whenever they feel pain or they are sad. So this will normalize expressing, and it will make people men not to hoard, but to express emotion whenever they are passing through. We should be able to allow men to cry if they so wish to cry. It's important for us to allow people to recoil, take a day off or two from places of work so that they can rejuvenate and come back fully emotionally intact. So thank you so much. I would like to pause at this point and also take questions and comments that may come from the house. Thank you very much.
Okay, thank you so much, Dr. Ibrahim. I believe you made some very, very salient points, and we had people even commenting in the comment section. But if we do have any questions for Dr. Ibrahim, could you please raise up your hands or signify by raising up your hands or have your
Okay, can I start attending to those in the chat, or do we take from others before we
Yeah,
take the chat?
we will start with that. I will read out the questions so that you can answer them. But if anybody has questions outside of that, you can just signify by raising up your hand. So I would unmute your mic and let you speak. So we have a question from. So this is not a question. Dawda Waziri says, how to identify distress among men? They don't always speak out. They involve themselves in unhealthy behavior such as gambling. Dada also says the main challenge is that men don't tend to open up because of fear of stigmatization. And he also added that true strength comes from courage to speak out when in distress. Okay, so I'm not seeing any questions. Okay, we have one new. Okay. Please, if you have questions, please signify by raising up your hands. You can use the chat box. This is supposed to be an interactive session. The more we interact with the presenter, the more we understand the concept of what we're trying to learn today.
Okay, so but I think I can talk on what Baba Sharima mentioned. I strongly agree with you, Baba Sharima. Um, they say men shouldn't cry, but we should understand that men are human and also men should be able to express themselves. Emotions, when bottled up, actually piled up, and when they decide to explode, it is not good. And that is why we have high rate of completed suicide among men because of the bottling up of something and unable to express themselves. So, but when you are able to express yourself, it is easier to get help. And Dauda Waziri, how do I identify distress among men? As I have mentioned, easily getting anger, irritable mood, risky behavior like gambling, excessive use of drugs and alcohol, and also keeping themselves much occupied, and then also keeping to themselves like isolation and refusing to talk could be form of distress. Indeed, men don't usually like to speak out, but we do encourage that it is important for us to speak out so that we can get help. And as you said, gambling is an example of an unhealthy behavior. And Dodo Waziri also mentioned the main challenge is that men don't tend to open up. I agree with you due to challenges. All right. Thank you very much, Dauda, for your inputs. And any other question?
Any other questions from our participants, our guests?
Okay, I think there is a comment by,
Yes,
okay.
we have. Okay. So Helen Balami says, how can a person who is feeling mentally unwell seek medical intervention? Can they access a psychiatrist or a mental health specialist? That's her question.
Okay, yes, you can assess, although I don't know where you're currently residing, but I would like to say that there are about 7 neuropsychiatric hospitals in Nigeria, and also virtually each university teaching hospital has a psychiatric department. And also, it may not really be a psychiatric department, but I would like to say that even this, our platform has a lot of resources which you can use to tap. So there are organizations that provide mental health and psychosocial support services to individuals depending on the level of severity. But you can access mental health services at the lower level at some of the primary health care centers, at some general hospital, and of course at a university teaching hospital. But if you are in Maiduguri, the Federal Neuropsychiatric Hospital, Maiduguri, is a mental health service center where you can access service. Thank you.
Okay, thank you so much, Dr. Ibrahim. I hope your question was answered, Helen. We have Kubara Abib asking that you've highlighted a lot of the challenges of men's mental health, but how are persons who have been convicted for criminal offenses encouraged and rehabilitated? More importantly, how does rehabilitation enhance the state of the mind of a convicted person?
All right. It is important to note that the, those who have been convicted, who are serving terms in the correctional centers, have, like Meduguri has a psychiatrist that often visit that hospital. But I would like to say that the rehabilitation they receive may not be adequate. But for individuals who abuse drugs, they usually receive counseling from the staffs of those correctional centers. But for those who suffer from mental illness, depending on when the mental, if you have suffered mental illness before the act, it means one can be exonerated by virtue of the mental illness. But actually, detention has been linked with high prevalence of depression and anxiety disorder, of which they can actually be taken to hospital to access services. But honestly, incarceration has some limitation when it comes to the extent to which one can continue to access mental health services. Thank you.
Okay, thank you so very much. I wanted us to unmute somebody that just raised their hand, but it seems they've dropped their hand back, and I don't know who that is. If that's you, can you quickly raise your hand so I can unmute you so you
That's
can
Jibrin.
speak?
His name is Jibrin.
Jibrin, okay,
Yes.
Buba,
Jububa,
okay.
yes. Yeah.
Jibrin, do you still want to ask your question? You have the floor to speak. I'm trying to unmute you, but I think you have to do
Hear
that
me?
yourself.
Okay, can you hear me now?
Yes, we can hear you. Good evening.
Okay, even though even though from my end the network is fluctuating, but I'll go.
Okay.
I want to ask a question about those people who are introvert in nature. So you know they are always silent. So how is there any yardstick to understand if they are mentally they have problem with stress or they are mentally not okay because they are always silent?
All right. Thank you very much for the question. It
Is
is
there any
important.
yardstick to know if because they are always silent?
Hello.
How can we help such kind of people? Thank you.
Okay, I think if I get him correctly, he wants to know about people that are introverts and how to identify if they have any sign of distress and how to help them. I think it is important, usually in psychiatric assessments, you identify the premorbid personality of the person. If the person is usually the quiet type, you now look at the worsening of the quiet nature of the person, because there has to be a baseline. But usually you could see that they have become much more quiet, and they may also engage in use of drugs in order to mask this illness. And also you realize that some people may actually, instead of poor sleep, they may sleep excessively and isolate themselves further from individual. And just like any other person, if you observe changes in the pattern of behavior of such person, then it is important to take such a person to hospital, or you advise such a person to go to the hospital. But there is a need for caution so that we are not overindulging the person, because naturally they are quiet, but most people that are quiet actually have one or two people that they usually open to. So these are some of the resource capitals that we should bank on and to assess how these persons are doing. But it's important, if you see changes, this person should access services in the hospital, not that myself or you will begin to conclude. It is the psychiatrist, psychologist that should make the conclusion. Thank you.
All right. Thank you very much, Dr. Ibrahim. So we have a question from Baba Sherima. How can workplaces create a more supportive environment for men's mental health?
All right. The workplace culture generally should understand that men are also human, because sometimes you see that even in the workplace, men are usually overburdened, and they'll say, don't you know that this is a woman? And before you know, the men will shoulder most of the work, and that will add a lot of stress. And you realize that as men, if not of recent, we don't even get much of the break. But the introduction of paternity leave is one of the culture or initiative that can help the improved nature of the improved mental state. Because although we didn't give birth directly, we also pass through stress during that period. Often we are in the hospital along with our wives, and also the up and down and the preparation of naming ceremony is really downing on us. So these are some of the cultures in the workplace that can allow us to rejuvenate, and also allowing men to go on leave. It is important so that men can be able to rejuvenate, and also giving listening ears to men who are passing through distress. It is important to note diminishing performance amongst men, so that we should ask questions if all is okay or they need help. So I think this can further help to dampen distress amongst men. Thank you.
Okay. And I just wanted to add about the work culture. So these days we have organizations that are actually doing employee assistance programs, in the workplace. So we encourage male employees to try and be a part of those programs. So it's very, very helpful. So to the next question from Kubura Habib. Do you believe the correctional services in Nigeria actually correct convicts? So I think she means rehabilitates convicts.
Well, to be candid, I may not know much about what they are doing, and the correctional nature of what they are doing, because I've seen instances where people have gone to university and they have graduated while in detention. There are also instances where persons have learned some skills, and by so I would say that to some extent, people are being rehabilitated. But there are also instances where people have become hardened after they have served their terms. So it is not an absolute phenomenon. Some benefit from it while others do not. So, but there is always room for improvement, and I wish someone from correctional services here, so that we begin to encourage where more and more counseling sections are taking place, more and more occupational therapy is taking place, and also more and more psychosocial support is being provided to persons that are being in detention. Thank you.
All right. I was about to ask Helen to speak, as her hand has been up for a while, but she has dropped. I think she has gotten tired of raising her hands. But let's go to Dauda again. So, sir, I have a friend who is struggling from lack of sleep. Does that mean his mental state is not normal?
All right. Thank you very much for that question also. So in mental health, sleep is like fever. So when somebody has fever, you may have elevated blood temperature, and it may just come down with paracetamol and no problem. But in most cases, sleep is associated, it's like a symptom, it's not a diagnosis. Sleep could be like one of the symptoms of a mental illness, but to be candid, a full evaluation needs to be taken place, needs to be done before you conclude. So just by saying somebody is having poor sleep, I may not conclude. I would like to take a thorough history to understand what what are the other symptoms that could be associated before we can conclude that this person is having a mental illness. So I will suggest that the person seeks for help, so that he can be evaluated, he or she can be evaluated fully.
Hey, Miriam Emmanuel says you mentioned about the panic disorder, which was initially caused by stress, but because people felt stigmatized to visit the psychiatric hospital, they just stay back until they start developing some medical cases. Does that mean someone should always access mental health facility first before the hospital?
Oh, okay. It is actually not that straightforward because mental health services are often secondary or tertiary services. So, but you should go to the hospital and see a doctor. The doctor will identify what exactly is the concern, because panic disorder may present with palpitation, and palpitation can be like a sign of physical illness sometimes. So, but when the doctor sees you, the doctor will be able to know what exactly is wrong with you. Then from there, they can refer or triage either to the mental hospital or to see the cardiologist, or where he feels you can receive service best. But whichever is close to you, you can also go to the psychiatric hospital to see the doctor. If it is not a psychiatric condition, they can also send you to see the other doctors that can be of help to you. The most important thing is for you to access healthcare as soon as possible.
Okay, thank you. Helen, hand is up. So, Helen, you can unmute to ask your question.
Hi, I hope my question is really important, but it's important to me. So I think my question basically is on the way I see people with mental health are treated, especially people who really are unwell, not just somebody who is experiencing depression, anxiety, or just still functioning. But sometimes these people are not able to function in the community. And maybe they are admitted in hospital. I mean psychiatric hospital. You see that they are tied in chain or physically restrained, let's say, in some way. And I wonder why such kind of treatment is still carried out in this day and age, where I believe that there's a lot of medication to be able to regulate the person's behavior or malfunctioning at that time to just stabilize them. That's one. Two, I feel that this kind of treatment basically fuels the stigmatization that we're talking about. Because when someone is treated like that, it means that if a person has symptoms or recognizes that they're having those kind of symptoms, they won't seek help because they're afraid of the way they will be treated or their family members will be treated, and also the stigmatization that follows in the community. So that's my question and a little bit of contribution. So my question is why this still happens. It may not be in a large context, but I have seen a few, and I just wonder sometimes why this is happening in this day and age. Thank you.
Thank you.
Thank you very much, Helen. I agree with you that such a thing could be seen in places, but I assure you that this is not happening in psychiatric hospital, especially where I practice. I work at Federal Neuropsychiatric Hospital, Maiduguri, and we do not practice such. Usually, we see such cases when they just brought the patient from the host community. So you cannot despite the enlightenment sensitization that this is not acceptable, people continue to practice that. But in our facility, immediately you come, we insist that this person be untied, and we do chemical restraint, not physical restraint. So usually when people come, instead of tying, we ensure that this person is untied, and if he needs injection, you give injection. But sometimes just de-escalation will do. I've had seen instances where I see people shouting and beating, but before you know, immediately you talk to the client and de-escalate the situation, they become calm. So the lack of professionals available have actually contributed to this, and it is important for us. In addition to service provision, we also advocate that such practices should be stopped and continue to sensitize people to stop this inhuman treatment to persons that are having mental illness. So I will agree with you that such a thing have continued to take place, despite the fact we do not advocate that. So, but we are still coming up, and people are learning too. Thank you.
Okay, we have a question from Jibrin Uba. It says, can stress lead to tremor? Can stress lead to tremor?
Yes, stress can lead to tremor, and it depends on the context also. Yeah, stress can actually evolve and become traumatic, and trauma actually is the ingredient for post-traumatic stress disorder. And in post-traumatic stress disorder, people can have hyperarousal, and tremor is one of the features they could present with. So it is possible. Thank you.
Okay, thank you very much for that. Um, so Kabara again asks, Sir, what are the chances of inheriting mental illnesses if it is self-inflicted through drug abuse and other vices by the parents?
Okay. I would say that if a parent is abusing drug, it is not inheritance now. The chances is a child is likely going to model. We call it modeling as an etiological factor. Children tends to model their parents by observing them either taking alcohol or cigarette. So there is high chance that children whose parents are taking drugs will eventually take drugs too. And also individuals or children whose parents have but if it is self-inflicted like drug abuse, the chances is you model. But if it is functional illness like depression or psychosis such as schizophrenia, there is like 20 to 30% chance of inheriting also from a parent. And if both parents have it, the chance increase. And if your twin sister or brother has schizophrenia, especially, there is also high chance of you developing mental illness. So it's suffice to say that mental illness have genetic loading, and the chances of one inheriting is actually higher compared to the general population or persons who have no family history. But in individuals where parents are abusing drugs, the children are also likely to model these parents and begin to copy them and also take drugs. Thank you.
Thank you so much for that response.
So I think I want to, before
Kawana,
we
you said
allow
something.
Ibrahim Sule to speak. Yes, I said, let me just add something to what Doctor have said before we allow
Okay.
Ibrahim Sule to say something. And I think also because the
Okay.
question it's broad, but just maybe to bring our attention to even women who are abusing drugs or alcohol and or substances have a higher likelihood of giving birth to children who are already addicted to uh, substances. But maybe Dr. Helen. So actually, Dr. Helen also is a mental health professional. So she is also here. So if you can step in, Dr. Helen, at any time with Dr. Ibrahim, I think that would be great so that we can also hear your perspective as well. So maybe we can talk about pregnant women abusing substances, how it also affects the child in terms of also addiction, because we also have that neonatal issues when a child is given birth to. So either Dr. Helen or Dr. Ibrahim can step in. And I can see also there are other professionals here. So if you want to just maybe shed light on that, please you can raise your hand and we can allow you to speak. I don't want to put you on the spot, but I know I can see you if you want to shed light on that.
Yeah, I think others should comment if they so
Yeah.
wish.
Judy, if you're able to speak, please do. I think maybe Dr. Helen have stepped down because I can't see her. But I know I ambushed Judy. So maybe we can take the next question and we can still respond to that after that.
Hey,
From
so I
Ibrahim
think
Suli. Yeah.
okay, his hands are up. Okay. Ibrahim, you can speak. Let me unmute your mic. You can speak.
Okay, good evening, everyone.
Good evening.
Yeah, I think it's a great initiative coming from that part of the country, and 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 I will say one thing. It's I will say it with um, with um, extra spicy pride that we are beginning to realize that there is, whether we think it's an epidemic or we're beginning to realize that there are issues that pertain to mental health, whether it's for women or men. And I think it's a conversation we should continue. Please, it shouldn't stop here. We should have other avenues to talk about it. It's real. I think, unfortunately, for most of us, we come from the part of the world where mental health seems to be we think and assume it's something that your village people are organizing for you. But I think it's real, and the way the country is, the way the things that are happening around us, the our lifestyle, it's it's something we need to keep talking about. And I hope that this is not just a one-off. It should be a continuous thing that we talk, share ideas, and help each other. Joshua, you might not understand, but I speak with pride because I'm from that part of the country. And I think it's good when I see people from that part of the country having this conversation because it is bad. The conflict has brought our home to a position where we have more people who are going through hard times, and it's affecting their mental health. And a lot of people have also gone to find things that will give them succor, quote and unquote, and they found drugs and other addictions. So I will keep encouraging, and I hope I will keep being part of it. Thank you so much for Dr. Ibrahim Michelia. It's awesome, and the experts in the room. Well done. Keep up the good work.
Thank you
All
so much.
right. Thank you so much, sir.
Thank you very much, sir. Long time. Well done, sir.
So, Jibrin Buba had, I think this is a follow-up to something they had said earlier. Okay, I think after saying can stress lead to tremor, he then proceeds to add, and if possible, could you suggest for us a physical exercise that could distract one from stress, sir, just to do away with the cortisol level? Thank you.
Okay. So since you said simple one, personally, I walk. Walk is the simplest exercise you can take to ease stress. I assure you, my sleep is always different the day I take a walk. So any day I take a walk, I realize I sleep sound, and I'm much happier because exercise increase blood circulation and every part of your system get nourished and rejuvenated, so it vents the stress. So I think it can be as simple as walk, but it can further depending on age and also your ability to move. You can do football, badminton, basketball, and other forms of exercises. So, but I would prefer an exercise where there are other people because aside the exercise, sports also is a social gathering where you interact with other people, you talk and laugh. So it has dual purpose. If you have to walk, maybe you get a walking partner, somebody you will take a walk and you'll be gisting. So it helps you stay away from your handset, from laptop and other things, and take a walk. At least 30 minutes, 3 times in a week is good for you. Thank you.
All right. Thank you so much, sir. Do we have any other questions?
Okay, so I think before we have a question, I would want to just maybe add, someone asked about panic attack earlier. And I think
Yeah.
from my own personal lived experience with panic attack, I would say it's usually not so obvious that it's a mental health illness. And this is me speaking as a professional who knows, all the theoretical, nitty-gritties of what it is. But fortunately, unfortunately, I didn't know that I was going through panic attack. So I was thinking, because I had relocated, I was just thinking it could be the weather, it can be change of environment. And that is to tell you that even us, sometimes we can experience those what let's say biases or whatever it is, that we tend to feel like, okay, this is far-fetched. But unfortunately, every one of us can easily experience those mental health illnesses. But then it's for us also to pay attention to those things, because we are most likely to be like it's a medical issue than a mental health issue. And that's a big problem because, of course, we've been in environments, and I love what Mr. Ibrahim was saying earlier. The environment where we're coming from, where we don't recognize mental health, we feel it's demonic, it's been spiritualized, it's just been put in different lights that it's difficult for one to pick when you're going through mental health illnesses. But then I would always say pay attention first to the mental health aspect of your life, because that also triggers the medical aspect. And I'm sure Dr. Ibrahim would agree with me. We have people having, stomach ache, headaches, severe uh, bodily symptoms that would just show. You'd go to the hospital, you do scans, x-rays, and they tend not to figure out exactly what's wrong with you. And I think that's the time for you to think about checking yourself out mentally, like what's going on with me? Am I stressed? Am I dealing with issues? And sometimes it can be PTSD, which we can see can lead to so many things. You can even lose your memory. It's deeper than what we talk about. But I will really encourage us today to just have an inner reflection of, if I'm to put myself out there and be like, okay, mental health, how have my life really changed? When maybe, for example, after you've lost a loved one, a close family member or a friend, you realize now all of a sudden you can't sleep over a very long period of time, nightmares, all that, and then you're having migraines and all that. Now you can be able to pin like to think back and be like, okay, this happened to me when this happened. This happened to me when, let's say, my wife gave birth, I was in the hospital, or when my child fell sick. Because today we're talking about men, so I'm focusing on that, because these are the triggers that can trigger a lot of these bodily symptoms that we mostly would go to hospital and would not get results. I think we can now start paying attention to mental health issues. And also, going for an evaluation is not a bad thing. If you feel like, okay, at this point, I don't even know that it's mental health, it's stress, I don't even know what it is. That's why we have people like Dr. Ibrahim, we have people like us who can just talk you through the process. Just have an assessment done so you will know for a sure, what am I going through. Doing an assessment is not like the end of life when you are diagnosed with severe depression, for example, severe anxiety. That is now the time for you to start working on your healing journey, because the more you delay, then the more other things get into it. But yeah, that is just my take on that. I don't know if there's anyone else before we. And I really love the way the men are asking those questions. I really love that. But let's even hear even from the women, if you have a man in your life, husband, kids, and you have those questions, please feel free to ask. I'm not seeing the women asking questions. It's not only for the men, but also women who have kids, you have husband, spouse, partner, you have men around you. So how can you also help them? Because for me personally, apart from being even a professional, you say, okay, she's a psychologist. That's why I'm more, I always want to learn about, okay, if I have a brother, I have friends around that are men, how best can I help them? And it's around about having these conversations. And I'm happy that we're having this conversation today, Joshua. Yeah.
Yeah.
Joshua, I don't have anything else to add from your own perspective, especially around stigma when it comes to men speaking out about their mental health issues. So we allow Dr. Ibrahim to have a break.
Okay. I
Yeah.
mean, you know, it it used to be an interesting conversation about, men, masculinity, not speaking up, keeping things to yourself. But for me, especially since since I got married, starting to have a family of my own, it went from being interesting to being concerning. And I say that because I have guys that are friends, right? And I noticed that we don't really talk about, what's really going on, how things are. Like, I mean, after like 5, 6 months for me in marriage, I felt like I needed to be in a community of men that are married, dealing with the pressure of, you know, providing, being that resource figure in an economy or in a world where, things aren't going well for us, the average African or Nigerian, even across the world, right? And the pressure that it brings to men. And I've been asking myself a lot of questions because me, I know how to talk. If something is doing me like this, I would speak up, right? And I always make this reference to this guy, even though most people don't like him. This I don't want to call him a nuisance, but this Portable is his name, right? This guy, one of the I don't want to say I dislike him, but the thing I love most about him is you can't like when something is going on, he will speak up. He will shout and say, yeah, 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 they want to carry me. Yeah, 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 something is going on. So it's always fair that we're in situations where, regardless of how tight it is, we should be able to disclose whatever those issues are. Because one thing I've come to understand is if you do not speak up soon, when it's just maybe 2 stones. By the time it gets to 100 stones, it's on your body, the weight is a lot, you can't speak. The problem has now gone from something one person could have solved for you to something, you have to involve 100 people. So, I mean, the sooner you speak, the earlier you speak, the better for you. We shouldn't allow things to compound, right? And it doesn't make us less of a man when we speak to people, when we tell people about issues that we're dealing with our, with our emotions and things like that. It doesn't make us less of a man. We understand, how society has been structured, but to me, I believe it has been structured in an unfair.
Okay. Bari Michelle, yana da ake.
Okay. I believe that it has been structured in an unfair manner for the man. And now that we're starting to see the unfair, how will I put it now, the unfair gains of how the world viewed men and masculinity, it is only right that we allow the men breathe, we allow them speak. we encourage them to speak, which is very important for our ladies and our wives, our mothers, our sisters. Us speaking doesn't make us less of a man, right? So let's encourage every man out there to speak when they have problems, with their emotions. And I think that, the world would definitely be a better place. But that would be my own input thus far. Okay, so Dauda has shared our social media platforms. You can follow us on Facebook, Instagram, YouTube, where I believe this session is live, so that you can get updates. The email address is also there in the chat box, where you can send emails, inquiries, and there's a TikTok as well. Jibrin, has another question. I think this should be one of the last questions before we allow the closing remark. Sleep talking, sleep paralysis to some people is spiritual, while others say it is the result of daily habits. How true is this? And is it related to stress or trauma? Dr. Ibrahim, do you want to answer this for us? Your mic is mute now.
Well,
Okay.
there is a lot of misconception. Not only sleepwalking and all those talking, there is what they call sleep paralysis. So, in mental health, these are actually sleep related disorders. They call it parasomnia, and it has been shown that it can be treated. So, I'm not saying that there is nothing called spiritual. Since one believes in God, there are spiritual issues. So, but these are medical conditions that are treatable. And as such, I would say that these are medical conditions and they are treatable. And stress is actually a very serious thing that presents in a multifaceted manner. It aggravates existing mental illness, it precipitates a mental illness, and it perpetuates mental illness. So stress can present in so many ways. People who have their symptoms that have actually resolved can resurface because of stress. So stress can also manifest as sleep disorders. So that is my take for that. I don't know if someone wants to add to it. Thank you.
Okay. Thank you very much for that response. I believe that we can stop accepting questions. We don't have any further questions now, but we would allow for the closing remark. But thank you so much, everybody, for your interaction. Thank you so much, Dr. Ibrahim. It has been a very eye-opening. It doesn't stop to be eye-opening, right? We hear about these things every day. We'll continue to hear, and we'll also continue to champion for everybody, not just men, but everybody to be aware of, this sort of issues and the roles that they have to play in society. But over to you, Kawana, to give us the closing remark.
All right. Thank you so much, Joshua. Thank you so much, Dr. Ibrahim, and all the participants here today. I want to say a big thank you for making the time to be here today. And I believe, like we said, it's not going to be the last. We will keep convening. For now, we're convening every like once or twice in a month, but we believe that in the coming time we will try to make it weekly. But of course, engagements and all that. But thank you for everyone, the team that has been working tirelessly to bring this together. I really appreciate you all. For those who don't know me, my name is Kauna Malgui. I'm the founder of Digital Rights and Mental Health Initiative. I'm a clinical psychologist and I'm very passionate about mental health. And of course, like Mr. Ibrahim have said, from where we're coming from, we are coming from a very traumatized and troubled community due to the insurgency and all. And of course, Nigeria right now, I always tell people we are kind of traumatized daily because as you step out, you don't even know what's ahead of you and all that. And for me, it's passion. It's also, the zeal to see that one day mental health is easily discussed without stigma, without any hesitation, without any form of fear. And this is a community that we're building, and I believe what you had today, you can
I don't know if this is my network.
someone else share with your friend. Mental health is not the end of life, it's just part of human nature. And we need to take care of our mental health as possible. Uh, we can you just on it. Let me know if anything. If you just give emoji to you can hear me. So can you hear me?
Yes, I can hear you, but I don't
Can
know if it's
anyone?
my network because it sounded like it was breaking.
Yeah,
I
it
don't know if
was
it's mine.
cracking a little, but
Okay, yeah, so it's definitely her network, so hopefully she joins back. Um, yeah, she's back up now.
Can you hear me?
Yes, we can hear you now.
All right, I'm so sorry about that. This is part of, being in this part of the world where a network can go off at any time. But yeah, what I'm saying is part of what Digital Rights and Mental Health Initiative is about letting people know the importance of mental health and also try to create that awareness because we are the ambassadors that will speak to our communities, will speak to our family members, and we are the ones that will take this message across. So please follow our Facebook pages, Instagram, LinkedIn, whatever that works best for you so that you can always see when we are having another session. But uh, let us also know if you have any question, any concern, if you even have any mental health issue that you want to speak, because we don't also want to just leave you with the information and then you have much questions. Our email address is also there. It's confidential. So please, you can write if you need any form of mental health support or care. We are limited to some extent, but yeah, we'll try our best to see that we attend to any case that we have. But please don't keep quiet, don't stay in silence. Always reach out if you really need help. Please reach out. Silence have taken a lot of people out of this earth, but we have now a place and a community where you can share. And if you are in Maiduguri, Borno State, and you also need consultation, whatever, of course, reach out. We have Dr. Ibrahim, which is, very passionate about this uh, work, and he has been a very great resource. I just want to say thank you, sir, for, just coming to speak to us today out of your tight schedule. We really appreciate the time. Joshua, thank you so much. I can see it's like you're still in the office. You had to stay back just for this meeting. I really appreciate that. Joshua is my classmate from way back. We did our undergrad in psychology. He's one of my good friends. And years later, I think almost, is it now 11 years or 12 years later, we are still in touch, and I'm happy that he's been able to step up and just hold the space for us. So please, if you have any topic, anything, kindly reach out to us. Our WhatsApp group is there. You can please join if you're not part of our WhatsApp group, where we share all these updates there easily, but our social media handles ensure to follow. And of course, a very big thank you to everyone who have stayed behind till this time. We are going to host a webinar very soon where we would have men and women in different groups. And I'm excited. We're planning something and where women and men can talk, and then we can come together and just discuss, because when we talk, we're going to know where are the issues and where we can also be of help. But from me, thank you so much. And yeah, as an organization as well, we are trying to expand. So please forgive us if things are not running the way it's supposed to. We are please open to feedback. If you have any feedback for us, how we can improve, what we can do better, what we are not doing better, we are please open to those feedbacks. Please let's have those feedbacks, and we'll be very happy to work on our webinars so that it can be as helpful and productive as possible. And also, if you want to support the work, because most people want to join, they don't even have the data to join, unfortunately. So if you want to sponsor people to just join this webinars with data or whatever, however you want to just support the work, please let us know. If you have people who we can invite to come speak to us, we are very open also to that. So we need support all the way around. We're looking for partners and people who can just join us. Together, we can be able to make this, I believe the 20 or something people that have attended the session today, we've impacted over 100 people, because they are going to take this knowledge wherever they are and going to also, help themselves, their family members, their, extended family, and also friends. So, yeah, thank you so much for your time once again. I have my colleague here, Sarah. I don't know if you're able to speak. If you're able to speak, maybe you can just say hi as we close the session. Let me know if you're able to speak.
Thank you, Kauna. I wouldn't have much to say, but thank you for everyone that's contributed and the time. And yeah, we hope to see you very soon in the next session. But yeah, I won't hold anyone further. Thank you.
All right, thank you. We also have a project called Women's Digital Futures Africa. You'll see that also part of our page. Do well to also join those pages where we handle with women and boys issues. But now Dr. Ibrahim is saying we are focusing more on women, about a project for men. That is an assignment that I just thought of during the session today. Something that is from me. I just want to say big thank you once again, and see you in our next session. If you want to stay behind and speak to me, I will not be leaving. I will give like 10 more minutes. If you have anything else that you want to share or ask, I will be just right here to attend to any question or anything that you have. But I think that is it. Thank you so much, and do have a good night rest.